You're listening to Radio Cosmos.
All night long.
Bravo! My compliments, little lady.
Commercial!
Break for 30 seconds.
Commercial!
Transmission.
You are now listening to BaaD Radio.
Hello and welcome to BaaD Radio. BaaD stands for Business at a Distance. This is a show about local businesses and business networking. We are here in the News Radio WFLA studios from 11 a.m. to noon every Sunday, and I am your host, Angela Smarito. Before we jump into the show, though, I want to give a shout out to some of our show sponsors, because without their support, we wouldn't be here. So thank you to Forge IT Consulting for they provide a fully outsourced IT department with a personal touch for small business, forgeitconsulting.com. John helped me through a bunch of stuff this morning too. I'll tell you all about that. Get Me Automated. Ashley and her team educate business owners to grow their business through custom automation. GetMeAutomated.com. Osteopathic Health of Orlando. They offer integrative medicine, osteopathic healing, regenerative medicine, and so much more. Visit osteopathic.healthcare. And speaking of all that, we have somebody back in studio. Please welcome Dr.Kern back in studio with New Age Wellness.
Thank you.
I can't hear you very good.
Hello?
There we go. So actually, before we started the show, I was like, so what's new? And you started to tell me about all sorts of stuff that was new. So welcome back to the show.
Thank you.
And so we both agreed it's been about a year.
Yeah.
So
Time flies.
I know, right? So it's been a heck of a year, though, because you were telling me about some of the changes.
Oh, yeah.
So let's just go ahead and dive in. Well, first and foremost, let's tell everybody about your business name, where
Sure.
you're located, all that stuff.
Yeah, so we're tucked away on busy State Road 436 in Castleberry.
Okay.
Right near Red Bug Lake Road.
Yep.
So in that area. And it's New Age Wellness. We do a combination of, well, we started out during COVID. In 2020, we opened up and just did, just basic chiropractic, treating injuries and whatnot with therapies. And then, fast forward today, I'm in a brand new facility. And
So you moved.
So we're just like I'm a couple suites over in the same building, same
Gotcha.
location. We started and offering way more services than what I started out with.
Well, it sounds like that's happened in the last year, because we talked primarily about chiropractic when you were here last. So what happened that you're like, okay, I'm ready to blow this up?
So I would say about 6 months ago is when I started the transition, which has always been my goal in mind, to get to a point where I was doing more integrative things and doing multidisciplinary in the office. That takes some time, especially during a pandemic,
Right.
But now I'm at a point where definitely we're offering a lot more services. I have 2 primary care providers in the office.
Very nice.
So, and myself and a massage therapist. So we do everything.
So how many different people are in your office?
So there's 4 providers, including myself. And so we have 2 primary care. We're doing, regenerative medicine.
Okay, let's just stop and talk about what regenerative medicine is, because I am a full supporter of alternatives to HMO. Get your primary care, you go to the doctor, you get your 5.45 minutes with the doctor, he writes you a couple things, and then you're on your way. So I'm not a fan. So I love talking about alternatives to that. But with regenerative medicine, we're talking about living longer, healthier lives, right?
Yeah, so it's a new type of medicine compared to modern allopathic. We're going in for...
Is allopathic antibiotics and stuff like that?
It's the opposite of holistic.
Okay.
So it's where you're dealing with things that sometimes are ineffective, like with drugs and surgery. And so regenerative medicine is more natural. It gives the body a chance to heal something still naturally in different ways, with vitamins and your own DNA and, brand new stem cells that are, a part of healing too, and that we're all born with, opposed to going in, taking a knife, taking something out, or putting something in that's not,
part
natural.
of your body.
Right.
So stem cells, when I think of that, I always think of stem cell research. And for some reason, there's a black cloud that's over it, because did it have a bad stigma around it, or where they were trying to say that it was bad in some way, but I can't remember exactly. So
there's different types of stem cells.
Right.
The ones that we do are sourced, and some people get them and go to different clinics for different type of stem cells. And so the ones that we're doing are not your own bone marrow, or they're ethically sourced from an FDA cleared facility in Tampa that are from donating mothers.
So was that what it was? Is that people were using stem cells that were just like harvested or something that it shouldn't have been?
Yeah, so there's all types of different stem cells. So it's very important to be clear on the source of where you're getting the stem cells.
And what exactly does that do? So a stem cell is what? Sorry, I'm going to ask you a lot of questions because I just don't understand. I mean, I understand the overall picture, but I want to understand the specifics.
Yeah, so they're called human cellular tissue products. They're mesenchymal stem cells, which are from the Wharton's jelly umbilical cord stem cells that every birthing mother has.
I heard that the blood and stuff like that's in the umbilical cord, everything is like just gold.
Yeah, it is. And some people, decide to store it and you pay these facilities to put them on dry ice and freeze them indefinitely.
I wish I would have done that.
I know a lot of people wish, I wish I would, because we use it for a lot of things. People use it for hair restoration, joint regeneration.
No kidding.
They use it for non-surgical facelifts, tons of things.
Wow.
So,
I would have known. I wonder, you don't, anyway, go ahead. Sorry. Yeah. I was about to go off on a whole thing and I'm just not going to go there.
So we do all of that. It's very powerful to help regenerate any kind of damage that's done, to give patients the last chance to avoid a irreversible procedure like surgery.
Yeah. Give us an example where you've used it and you've saved somebody from having to go to surgery. Or
we've had tons of patients that have had, for example, like compression fractures in their back, and they don't want to have surgery and they want to heal it naturally. They've had recommendations for joint replacements, for knee replacements, or, hip replacements. And even my own father, he's had a complete tear in his rotator cuff and a partial tear in his other rotator cuff.
My goodness.
And he's already, college player, sports, coach. He's had all kinds of surgeries already. He's had carpal tunnel releases, both knees replaced.
Poor guy.
I'm like, Dad, you do not need another surgery. And he's tried physical therapy. He's been on a lot of pain medications and cortisone injections, and
I've heard of cortisone injections. They're temporary pain though, or pain relief, right?
Yeah, and they actually can cause a lot of bad side effects. But so I got him in for some regenerative medicine. He's had 2 sessions on his shoulders, and he's able to do a lot more things.
That is so cool.
Yard work and lifting in the gym.
What does the session look like? Is it just injections or something, or how does it work?
Yeah, so once we go in and get you a consult, make sure you're a candidate for it. Most people are.
What would make somebody not a candidate?
If they've had active cancer that's not in remission for a period of time.
Understood. Okay.
If they have a blood clotting disorder, if they're on a heavy blood thinner, or
okay, that makes sense. Anything that it could get triggered or make something happen.
Right.
Like the blood clot, I totally get. Yeah. Cancer, you don't want to excel. You don't want to mess with any of that stuff.
No. So those will make sure you're a candidate. And then depending on what kind of procedure we're doing, because if we're doing something called PRP, which is platelet-rich plasma.
I've heard of that before, and like facials and stuff like that. So I might be doing that stuff pretty soon.
Yeah.
I notice all sorts of stuff going on over here and up here.
It's way safer than Botox, what we do. You're not injecting a neurotoxin into your skin. You're just using your own DNA and maybe some hyaluronic acid.
So you're not freezing.
Right, you're paralyzing
your face.
So it just depends on what we're doing. If we're doing like, hey, you're a good candidate for PRP, we'll do that. Or hey, we think stem cells are the best option for you, we'll do that. And we treat really bad issues for patients that have already gone to a surgeon, been recommended surgery, and said, hey, I don't want to do that, and they were living in pain and they're scared of surgery. So hey, this is a reign of hope where we're going to give them an option and say, hey, this at the worst, compared to surgery, it does nothing, but at the very best, it's going to cure your pain.
Right. Well, that music means we're going to go to break. Is crazy. It goes so fast. But we're going to pick up when we get back. So everybody stay tuned for some more BaaD Radio coming up. Welcome back, and this portion of the show is brought to you by Premier Couples Superstore. There is no better time than now to visit Premier Couples Superstore because they have got a huge selection of lingerie, toys, love oils, and a ton of great gifts. 5009 South OPT or shop online at premiercouples.net because a couple that plays together stays together.
Oh, yeah.
Right, baby. And we are here with Stephanie Kern, and the name of her business is New Age Wellness, and she was on the show last year when we were just talking about chiropractic. Now she's opened up her business to a whole other slew of, and right now we're talking about regenerative. And I find it fascinating. And I even asked her on break, I was like, do you mind if I ask about the little specifics? Because I think what a lot of people, I think the biggest hump is for people to start to understand. Mm-hmm. And because that's the biggest thing is people are scared of things they don't understand. And especially if you've got a doctor saying, well, you need to get surgery. And, you know, we've all been trained to trust your doctor. And so especially people my age, they're Gen Xers, you know, we were not taught to question the authority of the doctors. The younger generation, the Gen Zs and whatnot, they have a little bit more open-mindedness when it comes to, you know, that sort of thing. So I think it's important for us older folks to understand that we have options other than surgery. So, and we talked about kind of like walking through a scenario. So
yeah. So once we get you in for a consultation, we go over your options and do an evaluation of whatever condition you're in here for. And we always base our recommendation off of current evidence to give you an educated, decision. So if someone comes in and they're young and they're, very little medical conditions and they have a really severe injury like a meniscus tear or a rotator cuff sprain.
That's their knee and stuff, right? I know meniscus. I've heard that before.
Yeah, any kind of tear, sprain, something where, they're trying to avoid surgery for and get in there to repair it. We would say, hey, you're probably a good candidate for PRP. So what that would look like is we get them in and the procedure would be within 30 to 45 minutes.
Okay.
You're able to go home that same day. There's no medication, no anesthesia, no,
Oh, wow.
Nothing like that. So it's an in and out outpatient procedure. The nurse comes in, takes a small vial of your blood. We spin it through something called a centrifuge, which is a spinny device, and it separates your red blood cells from your platelet-rich plasma, which is very clear, and that's responsible for clotting and repair of damaged tissue. So we're taking that into a syringe, and the nurse will inject it into the area that's injured, and you're in and out, very comfortable.
It's stimulating your body to start to heal itself faster.
Right. So we're telling your body, hey, focus in on this area, let's repair it, and let's, work on the inflammation that's in there and stimulate healing. And so it's just using your own DNA. So she makes it very, very comfortable. There's a free spray, very small needle. And people are able to go home that same day and do normal activities, go back to work.
Is it something that helps immediately, or is it something that you kind of have to do a couple times in order for it to kind of take effect?
Depends on how severe, how chronic something is. Sometimes we may recommend 2 rounds done a month or so apart, sometimes 3, depending if this is something you've been living with for 30 years. So it just depends on that. But, the PRP is fast. It's a faster way of pain relief, and it's a faster way of healing opposed to stem cells, which are a little bit low and slow. So stem cells are way more potent and aggressive and are far more superior in healing than PRP. So for somebody that's a little bit older and aged or mature, and they've been dealing with a chronic issue like low back pain.
I'll just call them old farts. We're just old farts.
So that's just depending where, hey, you've got some issues going on. You're diabetic. You have, autoimmune issues going on, because with PRP, you're your own ingredient. Okay. So with stem cells, you're getting something donated from.
Because your own ingredients might already be a little
not be as healthy, maybe a little bit aged. And so stem cells are newer, they're more potent, and it's just one injection. So it's usually a little bit lower and slower of regrowth and regeneration opposed to PRP that's a little bit quicker. And
right. Well, that's another thing too, is like our society cracks me up because, somebody will live with pain for 30 years, but yet when they go to get treated, they want it like an immediate response. And I'm like, you spent 30 years, but yet you want to go in and get like a magic pill and it's going to make the pain disappear. So
that's kind of puts people a little bit in the middle of medicine and chiropractic, because if you go in for a sprain and you want to see chiropractic, any standard good chiro is going to want to see you more than one time.
Of course.
And so that's going to just speed up your body's healing process, but opposed to like going to a medical doctor where they, hey, go take this pill, take this shot, pain's gone, but the underlying issue is probably still there, and then we have regenerative medicine in the middle, which is usually between 1 and 3 injections, and it's healing it naturally instead of masking it with medication. So you're getting a little bit of both worlds with kind of merging those two and incorporating this into our office.
Right. And then I'm sure that you accept insurance. How does that conversation go?
Yeah, so of course we do accept insurance. We always go through that route and see what's covered, what's not covered. It depends on what needs to be done, that person's policy, what's covered, and then we go over all the options.
Do you have somebody in your office that helps them with that?
Yeah.
Okay.
Yeah. And PRP is covered, I know, because surgeons perform it already. In surgery, they use patients' PRP while they're undergoing some kind of surgery to speed up the healing process post-surgery.
That's very interesting because I didn't think insurance would touch that yet. But so they're coming along, so that is a good thing.
In some cases, yeah.
Yeah, because I think one of the things that drives me crazy about that whole scenario is that it's pretty. Lots of times it's the insurance companies that are determining the diagnosis and how it's going to be treated versus the physician or the person seeing them, the medical professional. It's like for that, you're allowed to prescribe this, this, and this. For this, you know what I mean? And that takes away, I don't even count them as doctors.
Yeah, it's, Blue Cross Blue Shield, I know they had that whole thing come out when we had that unfortunate, tragic, the UH CEO was murdered. And
oh, yeah, that was awful. Was that? No, I think that was United Healthcare guy.
Yeah, so then everybody was looking at insurance companies and what they're covering, and they're saying, oh, the Blue Cross Blue Shield's changing their policy with this. We're not covering anything past a certain time frame for anesthesia if you're under for more than 2 hours. And so everybody was in an uproar about that. And then they reversed the policy. And it's,
right. I do think it's funny is like you can get a prescription filled for Xanax, which is highly addictive, really bad for you. And it costs $1.25. You get a prescription for like a thyroid medication that's actually going to help you, and they're not. Oh, we don't cover that.
Well, I know that even our IV vitamin treatments, I know that Blue Cross Blue Shield will cover
that makes
a
me
wellness
happy, though.
A wellness infusion with our IV vitamins. But
well, let's talk about that a little bit. So tell me about the infusion thing.
Yeah, we have a ton of different ones for different things. If you're recovering from jet lag, if you're
Is that one of the ones that's like the hangover remedy or whatever? So people, or if they know they're going to go out drinking, they go and get that done, and it helps them not feel so
that's one of them.
Day.
Yeah, that's one of them. It'll be a mix of like magnesium and B vitamins and sodium, potassium, super hydrating, and then there's others that are good for like like NAD, which is really showing studies out for slowing the progression of things like Alzheimer's and dementia and Parkinson's. So a lot of people are going out now and getting vitamin infusions of NAD, which is an amino, and that's a 4-hour IV drip that we do here.
So they have to stay there for 4 hours. You know what I'm interested in is talking to you about is hydration. I don't drink enough water. I don't hydrate enough because I hate it.
Well, stay away from purified or distilled water. It is the worst thing that you could put in your body.
I don't drink any water, so no, I'm just kidding. I do drink some water. But I was like, if I could just...
It's not going to get in there with osmosis, so you gotta drink it.
But I could do like the hydrating one like once every couple of weeks and give myself a little hydration boost.
It'll help. It'll help you catch up a little bit, yeah. Because it's straight into the bloodstream. So it goes right into your cells. Your organs hang on to it, and, for who knows how long. You might need to come back on a 2-week basis.
If I have like a water sitting there and then I have a soda sitting there, I will drink the soda like 20 times, and that water will.
So you got to put the water in the soda can, and then it'll trick your
brain. Maybe. My brain doesn't fall for that. I've been doing good with like carbonated water, like LaCroix and stuff like that, as long as it's got some sort of carbonation. But I'm my own pain in the butt because so I'm like,
well, yeah, if you're struggling with like staying hydrated, like we have ones that are for hydration, some that are good for focus.
I'm interested in all that. So, all right, we're going to run to break. When we get back, we have more BaaD Radio, so stay tuned. Welcome back. And this portion of the show is brought to you by Ground Up Property Services. Do you know what your sprinkler system did last night? Probably not. So now's a good time to get your irrigation system serviced by Ground Up Property Services today. And be sure to ask Rick Hall with Ground Up about a water sensor too, so your lawn doesn't get too much water. Call 407-468-4295 or visit groundupinc.net. And I'm very excited. I've been having a great conversation with Dr.Kern, and she is with she owns New Age Wellness. She's not with it; she owns it. So I guess you're both. You own it and you're with it. So there you go. But we've been talking about like alternative medicine. We've been talking about regenerative stuff. And so we started to talk about like the IV drips, which I know that they like peaked out and when they first came out a couple years ago. And it was kind of trendy, to go get your IV or your IV drip before you go to a concert and you get hammered and you know what I mean? Like I saw a lot of that, and then I kind of lost. So I didn't realize that it kind of like found its home with regenerative medicine. I didn't. So.
Yeah. I think a lot of people started really looking for it and seeking it out post-COVID or during COVID because everybody started really focusing on their health, and they're like, "Wow, I really need to do something."
Isn't it crazy that some good stuff really did come out of COVID? I hate saying that, but
it changed a lot of people's lives.
The show. Business at a Distance came out of COVID. So if it wasn't for it, we wouldn't be here. Yeah. I wouldn't have a radio show or a business. Anyway. So,
yeah. Well,
so people start focusing on their health, which is a good thing.
So we do all kinds of vitamin drips. There's some good for just wellness, making sure you don't get sick. If you are sick, then we recommend a vitamin C drip, which will actively help you just shoot up your immune system and get over it much quicker.
Okay, so if somebody seems to be picking up things over and over again, just chronically ill, you think that a drip would help?
Yeah. So we would do, like, typically there's the standard, which is called a Myers cocktail. That's the standard for wellness. But ours that we offer is like far more potent and has much more vitamins in the infusion. So that's just for overall wellness. You're going on a trip, you're taking going to be out of the country or something.
Sure.
You want to make sure your immune system's top when you're around a bunch of people that may be sick. So that'll keep you from getting sick and help you prevent that. But if you are actively sick, then that's a whole nother one.
Okay.
So it can help you get over the colds, the flus that are going around and all that stuff.
That's so interesting, especially, like I said, if you are going to be going out of the country. All right. So have we covered everything that's in the regenerative world?
Yeah, I mean, we do cover the stem cells, the PRP, and the IVs. We talked a little bit about the NAD one, which is also what makes it regenerative. Is that one? It helps regenerate cells, and that IV drip. Actually, they've addiction centers actually do that drip as well because it helps with recovering from addiction.
So when you're going through withdrawals. See, I told you that before we start the show. I'm 6 years sober, and one of the things that scared me the most about quitting drinking is going through withdrawals. And I have a group. It's called Pass the Buzz. It's just for women, and like I help women that are dealing with it, and that's what people are scared of. And so if you're going, so this is an option to go and help minimize some of the side effects of withdrawal.
It's an enzyme drip, and it's 4 hours long, and it's depends on if you need a half dose or a full dose, but it affects the brain, the nervous system, your metabolism, helps you detox, everything. So it's a very strong IV drip. And like I said, a lot of companies are doing it, and we've seen really great effects from it, and it does kind of tap into that regenerative medicine because it helps regenerate your damaged cells, which obviously can be damaged from any kind of addiction, whether it's from cigarettes or alcohol or amphetamines, things like that.
Because that's the thing with addiction, and that's the way it happened with me, is that those withdrawal symptoms were so strong that my only solution to make them go away was to drink. And that's what happens lots of times.
It's an epidemic in our country still.
Yeah, and I'm guessing that's with any chemical type of addiction, is that that's how you make them go away.
It affects your nerves. Yeah. It'll actually kill them, but there's some research that shows that it can help grow back, but very slowly. So if you're looking for something to obviously regenerate and speed up that process, that's where the NAD IV drips really help a lot of people dealing with that.
I want to get some more information about that because I want to put that in my group because I'm always looking for alternatives instead of just having to like tough it out. I mean, my thing was like, I'm just going to take some Tylenol PM and try to sleep.
Try to sleep it out.
Try to sleep through it. But I'm not really sure that's really good sound advice.
Sleep it off. Sounds like something my mom said when I was like, just sleep it off. You cut your knee.
Right. No, I mean, heck, I remember my mom telling me if you got an upset stomach, drink a beer. It'll make you feel better.
Yeah.
Like, okay. Well, they used to tell us to put like alcohol on our kids' gums.
Oh,
too,
yeah,
when they're
whiskey and the gums if you're teething.
Oh, the boomers.
Yeah.
They still will say that stuff. All right. But admit, so you have the regenerative, but then you still have the chiropractic portion of that. So tell us all the different services. Because I meant being a chiropractic is more than just like adjusting people. There's a whole bunch more to it than that.
Yeah. I mean, we're primary care physicians and, we do the typical neck pain, back pain, treating it holistically with some treatments and chiropractic adjustments. We do all of the therapy still in the office. We have a massage therapist there 4 days a week.
That's great.
We're open on the weekends. So we do it all.
Okay.
We do like massage, chiropractic, the regenerative medicine, the IVs.
Do you have a decompression machine?
Mm-hmm.
Okay.
Yeah, we still have that.
Yeah. Let's talk a little bit about how that works. Because I have some personal experience, not with me, but with my husband, because he had 4 whatever discs there, and he was in so much pain. And I was fully pregnant with my son. My daughter was like a toddler. She wasn't quite 2 yet, and he couldn't move. And it was awful. So we decided to have the baby, and then he's going to have surgery, but he found the decompression machine.
Oh, so he did it. Okay.
Mm-hmm.
So we treat disc herniations, degenerative disc disease, spinal stenosis, all those medical terms that create neck and back pain. If you got numbness, tingling in your hands and your feet.
Oh my gosh, he totally and so every once in a while it'll come back, and he just has to do a decompression machine.
It's important to do maintenance with that, just with anything. So sometimes we'll recommend a program. The patients will get through the program. They feel great. And then, hey, you're still doing the things that stress the body that created this issue. So let's talk about maintenance, whether that's once a month or once every few months. Come in, get the treatment so that pain doesn't come back.
But how does the decompression machine work?
It creates a vacuum effect because usually in the discs, they're very squishy and gel-like in between the bones.
Right.
And sometimes they can get hurt with accidents and sometimes dry out with age and create tears and ruptures. And
I mean, he's been like this for the past 20-something years. But it was from an injury from 20 years before that.
And sometimes we'll do a combination of PRP and decompression if things are really bad, if they're getting neurological issues, if they're getting weakness in their arm, that's really serious. And so we do the decompression. It'll create a vacuum effect and actually pull in any pressure off the nerve and stabilize the disc. So it'll keep it healthy, keep the pressure off, and reduce that numbness, tingling, that pain with the program. And so if patients are really bad, then we'll also say, hey, what will also really help is a PRP injection so we can get down the inflammation naturally and you'll feel more comfortable on the machine if you're in a lot of pain.
But does the PRP actually fix it though? Or is it the decompression it does
temporary. It does have regenerative properties
right.
To it. So it can help heal it in whatever tissue is damaged and causing that issue.
Right. So is back pain still the number one thing that brings people in?
Yeah, neck pain and headaches. We have tons of patients right now with chronic issues and tingling and what's called nerve pain in their hands. Some people will have a diagnosis called nerve arthropathy or nerve neuropathy. So that's a nerve pain. So they'll get it from diabetes or a disc issue in their spine or something, and that's something that also can help.
Can high blood pressure cause it?
Depends.
Okay.
Yeah.
That's interesting.
Yeah, more not so much more of a blood sugar issue or a nerve issue, something that's killing the nerves in the hands.
So you have the decompression machine. What are some of the other chiropractic? I mean, like you said, there's the adjustments.
Yeah, we have cold laser. We have
what's that?
So that's light therapy. You'll see a lot of doctors' offices do cold laser therapies. It's painless. You don't feel the laser. It's not like a hot laser like they use in surgeries. It's just light therapy. That type of light is healing and stimulating to any kind of injury, whether it's arthritis, knee pain, sprains, and
I want to talk more about that because I haven't heard. I don't remember talking about that one.
Really?
But we're going to go to break. So
sure.
So it's cold therapy, but it's light
cold
therapy.
laser.
Cold laser. All right. Well, we're going to go to break. When we get back, we have more BaaD Radio, so stay tuned. Oh, welcome back. And this portion of the show is brought to you by Frogger's Grill and Bar. Looking for a place to go with friends or meet new ones? Then you're looking for Frogger's Grill and Bar. And with 4 great locations, there is bound to be one near you. And you don't want to miss out on Frogger's amazing menu where everything is fresh, never frozen. Oviedo, Mount Dora, Apopka, and Altamont Springs. Frogger's. Hop in with food and fun.
I love Frogger's.
Yeah, I know.
They have really good wings.
Yeah, boy.
Oh, it's a little delayed, but you got it. They do have the best wings. And we're here with Dr.Kern with New Age Wellness. And they have like the kids like the black. Is it black and gold, like the UCF? Do you go to the one in Oviedo, or do you go to the one in Altamont Springs more?
Altamont, yeah.
Yeah, they have, like I said,
they make their own blue cheese and all their homemade like sauces and stuff. So you could just definitely tell the difference. I've been a big fan for years.
Oh, well, you know what? I'll have to make a little reel about that because they've been sponsoring the show since since I started the show.
I love Frogger.
Yeah, but they've been extremely supportive and it's a family-owned business. The owner's name is George.
I will say, past year, their wings have gotten a little smaller.
Yeah, but that's what they have access to that's fresh. That's just it. And they'll talk about that too, is they'll be like, listen, you know what I mean? That's what they can get unless they want to go frozen. But George is like, I ain't doing it.
Yeah.
He's like,
That's fair.
It's not. I mean, he goes, I won't substitute the fresh, never frozen for
the Franken stuff. Yeah.
Yeah.
That's fair.
All right, so let's jump back into it because you mentioned during the break aesthetics, and I was like, ooh, that's like I didn't even think about that part. But again, like you said, we are living a day and age where you know we can be 80 years old and look like we're 60, maybe. I think that's a little much.
So not only at our office can you feel your best, you know, but you can also look your best. So, you know, you can get the Botox and the face chemical peels and
offer
stuff.
that.
Yes. So we don't offer Botox.
Oh, okay. Sorry.
We do the more natural approach. So we use the human cellular tissue products, aka the stem cells, or the PRP mixed with some vitamin doses for facial, non-surgical facelifts, facial rejuvenation.
What does all that entail? Does it hurt? I mean, does it hurt? Like, is it one of those things where you leave your face is bright red for 2 weeks and then you have to kind of go in hiding for a little bit?
So it just depends because the PRP is using your own platelet-rich plasma. And we mix it with some hyaluronic acid. And so for doing that, it'll have some, you know, just like with any needles, you know, some redness for not too long, you know.
I've seen some before and afters that are amazing, though. Like as far as the results of it.
So we mix that, either PRP or stem cells, to make your face, you know, help with the fine lines and wrinkles and just produce natural collagen production, and the hyaluronic acid that makes your skin look bright and more toned, with an IV vitamin infusion, which also helps with that internally. So you're getting a heavy dose of vitamins to help, you know, keep that procedure and the effects longer lasting to support it.
I've noticed you've used the vitamins a lot. So you guys are just a big supporter of like the natural vitamins and things like that. Do you? I mean, do you yourself take like just regular supplements and stuff like that?
Yeah, every morning, vitamin C, iron, vitamin D, got the probiotics, you know, the magnesium at night, all the good stuff.
I had a doctor tell me once that it was a waste of time to take.
Oh, well, I don't know about that.
I also had a doctor tell me once that it wasn't, what did he say to me? He said, getting old is not a disease.
Is it a primary?
Yeah.
So it's funny enough. So if you look at the schooling between a medical doctor and a chiropractor, they don't have barely any hours of education compared to a chiropractor and nutrition. So their focus is on toxicology, pharmacology, and holistic practitioners are focused on nutrition for, you know, treating things naturally with, you know, heavy doses. So that's why we're always big components of that. And they're always big components because how we're trained is completely different in school.
Yeah. I just thought it was funny. No idea about peptides either.
Oh, yeah.
Do you guys do peptides as well? So I know that there has been some talk about certain things, and like there was a whole bunch of like really good ones. Like what was the one that I took? Ipamorelin after I did like I lost a lot of weight, and it was amazing. Like my skin, it almost, what it did is it almost gave me my figure back because I started to get square. Like, does that make sense? Like, you know, to go through menopause and your body kind of squares out and because you're not getting all the girly stuff. And then all of a sudden it's like I had my figure back.
Yeah.
So, but now I heard that it's not, you know,
I just think that any like medication is great in the short term to help your body get back to homeostasis. But in my opinion, like long term, we're seeing like a lot of side effects with people on them for a long period of time.
On peptides? It's bad?
So there are obviously a lot of, you know, studies that are coming out, especially with doses and patient's history. It all depends on what's going on, and you know. So we do them if needed, but then, you know, we try to keep it off a short term. You know, my medical providers, and kind of wean you off and keep you on more of a natural approach. And we'll go over like a weight loss program.
I thought peptides were natural, though. Are they not? I thought they were.
They just give you long. You know, you don't want to have to take a shot, you know, once a week for the rest of your life. So it's just something that you kind of want to learn lifestyle factors to support your body naturally. What you're putting in with food and vitamins that are a little bit more natural.
So in other words, you use the peptides to complement something that they're doing on a longer scale.
If you got to lose weight, we'll get you to your goal weight and help that accelerate that process. But we don't want to keep you, on that all the time. So let's talk about, hey, what foods you should stay on, what foods you should stay away from, and then you could.
I know, because you have to teach adult people how to eat because they don't know how. It's totally true. Adults do not know how to eat.
I mean, we were taught that food pyramid, and that food pyramid is, you're having to eat how much wheat and breads was the biggest part of that food pyramid, and that's the most inflammatory thing now we know that you can eat is bread, carbs, muffins, crackers.
That's the stuff I love the most. That's the funny thing is like anything that's bad for me, I want it. And anything that's like really good for me, like I just recently have started to enjoy fruit, which before I just was anti-fruit. If it wasn't chocolate or sugar, then I was like, I'm not interested. And it's so hard when my brain is wired that way. But yes, so
fruit's not bad for you.
Oh, I know, but I used to just
hate it.
I just was like, no, unless it's like some sugary snack, I wasn't interested. So I had to retrain my brain, and it's an ongoing thing. So you actually put people on like plans. I think that's great though. That you.
We do like an anti-inflammatory program. We give them like a whole recipe book of like 100 recipes to do. Like, hey, eat this, not that. We meet with them weekly. Hey, what are you struggling with? What do you have questions on? How much weight are you losing? Let's check it. And then we give them like some homeopathic herbs.
But are you doing like the Ozempic, semaglutide, that kind of thing?
That's what my nurse, if they want to go that route. But as far as what they do with me, we get them on that program naturally, give them homeopathic herbs to curb their appetite. If they're craving the carbs and the heavy, sugars and stuff like that, help purge their body of inflammation, their organs of inflammation with those herbs, and get them on some B vitamins for energy, get them on a good protein and preserve their muscle mass and all the good things.
So you do the protein via supplements?
Mm-hmm. Yeah, we use a company called Vitaline. Vitamed, and they use their proteins that are either pea protein for vegans or whey protein if you don't care. So
my body does like I do struggle with protein because my even the pea protein, like my body doesn't like. I can eat meat and be good. You know what I mean? Like if it's food protein, that I'm consuming, but if it's a supplement, like I said, I'm in pain.
So for women, protein is a big thing. So I would definitely recommend getting on a good protein so you're getting enough. And also creatine is really good for women.
Yeah, actually we were just talking about that. So so we are kind of wrapping it up. So now go ahead and give everybody all of your you have plenty of time. So go ahead and give everybody all your contact information if they want to make an appointment. Anything else that you can think of? Yeah,
so my website, newagewellnesschiro.com. You can see a big thing that says book a consult. Consults are free. We don't just to talk with me about your problem, see if you're a candidate, we can move forward. That's completely complimentary.
I love it.
They can call our office, book online if they're away from their phone, if they're busy at work. So make it easily digital. You can fill out all your paperwork online, all that good stuff. Phone number is 407-960-3237. You can email us. All that information's on our website, and should have some new updated information too. Our website should be done. Our new one, should be up and running in the next few days, but our old one's still there for people to see.
Well, thank you so much for being a guest. Like I said, thanks for letting me pick your brain. So,
I had fun.
So you guys, thank you for tuning in, and everybody have a great week. And remember to support local.